So the next panel is disability, the inequities within the disability community, inequities of the ADA, inequities of the Social Security disability system, and everything like that. We are going to have a 4-person, very candid discussion from all three of our all 4 of our perspectives. All 4 of us are disabled with medical needs, different things, of course, and we're just going to be discussing, having a candid conversation about this. And we, invite everyone to tune in, not just disabled people. This is for everyone to learn some of the struggles we go through. Before we add these 3 new wonderful panelists, I do want to say thank you so much to our sponsors. And I want to push, we have an incredible raffle ticket thing going on where you can win a basket with over $150 worth of merch, Medicare for All, shirt, hat, all kinds of treats. And you get one for every $20 donation. For instance, you donate $40, you get 2 entries, what have you. So we could really, really use the donations. We have upcoming events as well. And let's keep it real. Some of us from last July still have our expenses on our credit cards. So this is 100%, like, when we say grassroots, we mean grassroots. Like, we're a whole bunch of poor activists just doing what we can. So yes, anything you can donate is so much appreciated. So thank you again to these wonderful panels. And Andy, if you'd like to bring in my next guest.
And just one quick note, Joy, I'm so sorry, but we have not yet heard from Mr. Derek Graham. So as soon as we get him, we'll bring him in.
All righty. So I am joined by 2 fabulous people. The gentleman below here, you may recognize, maybe, from, see, facial expressions like that. There it is, right there it is. Mr. JB, brother from another mother. I do so many shows with you, and I love it. You are on the Revolutionary Blackout Network. And Michele, I've done some panels with you. You are an incredible disability activist and just an awesome organizer overall as a whole. So thank you both so much for joining me for this really important discussion. If you want to just elaborate and introduce yourselves more, we can go this way. Michele?
You're going to make me go first. I love being voluntold. So my name is Michele Mashburn. I'm a nonprofit executive. I'm also a disabled woman. I've walked through invisible disabilities and then now into visible ones where I use a power wheelchair. I also have a lot of complex medical things that I juggle as well. So that makes me kind of, everything informs what I do and how I do it. I've been on disability most of my life. I'm hoping soon to transition off, but that's a whole nother scary prospect, especially in light of our healthcare systems. So that's who I am. I'm also a Green Party member. There's a few other identities, but I'm here. I'm glad to be here. Looking forward to the conversation.
Absolutely. And Mr. JB?
Oop, he's muted.
You're muted, boo.
I'm sorry. Let me start again. Good evening, everyone. My name is James Fauntleroy. I am part of the Revolutionary Blackout Network. I also have my own channel called the JB Font Channel, also on YouTube. And I am a political commentator. And I also, I would say, I advocate for either a single payer healthcare system or a fully nationalized healthcare system.
Okay.
And yeah, I'm also disabled. My disability is more invisible. I suffer from chronic kidney failure. I'm on kidney dialysis. I go 3 days a week. I was diagnosed with nephrotic syndrome at the age of 8 or 9, I think. And so I've had to deal with having a chronic kidney disease ever since I was little, but I've been on dialysis for over 15 years. So it's nice to be here, and thank you so much for having me.
Of course. So we can actually start with that. That's a really great point. There are invisible disabilities.
Oh, yeah.
I will tell you guys personally, I can't drive obviously because of my blindness, but I am completely self-conscious about getting one of those placards for the car. I have
Mhm.
not even applied. I have this horrible fear that I'll be like, why do you have that? Because people do it all the time. I noticed, I just became disabled 2 years ago. So I noticed going in stores, um, like if I'm trying to put my charge card in, and I'm having issues. So JB, as someone with an invisible disability, what are some of the things that you would tell people about uh some frustrations that you deal with?
I just let them know, and if they want to say anything about it, then that's on them. It's like that's a you problem, not a me problem. Um, there's times where I know my limitations, and it's so if I have to express my limitations, then that's what it is. And if and I typically try to let people know that limitation beforehand, and so there's no ambiguity as to what I can and can't do. If they have a problem with it, then don't call me. That's basically it. And if they have an issue with it, okay, then that's your issue. But the thing is that part of my question is, if you have an issue with it, then you want to give me a kidney. If not, then then you're gonna have to deal with the issue, and that's basically the way it is. And we're disabled, but we're not. We're not. We're not somebody that is using our disability to inconvenience you. You know what I mean? And I think people need to realize that we've had to come to terms with it, but you also have to come to terms with it too if you want to deal with us. Because if you want to be in our life, then it's just like having a friend that is in a wheelchair, and you want your friend to come over, and you have a couple steps in front of your door, and you're like, just come over. And then as soon as they come to your front door, you go, oh, really? And it's like, you knew I was in this before you met me. So either you and on the rest of our boys come on each side, pick it up and bring me inside, or you build a ramp so that when next time I can come over, then I can get in. Until then this is what you have to deal with. And so that's something I think that people have to learn to deal with. Like, you have to focus on people's limitations. Like, for instance, people will focus on a pregnant woman's limitations when she's pregnant, and they're fine with it. But when somebody has a disability and they don't want to focus in on their limitations to help them be able to do what needs to be done, why won't you do that? And I'm not saying that being pregnant is a disability. Absolutely not. What I'm saying is that if it forces limitations upon you, in order to carry to term a healthy baby. So therefore that you do have limitations. Well, with being disabled, you also have those limitations as well. Or if somebody comes out the hospital, you have to do, they have limitations as well, until they fully heal. And so that's just something that I think that people need to be more cognizant of.
Absolutely. Michele?
Mm-hmm.
It's always interesting, especially being with other disabled people, in general on how much we take on the burden that society places on us. I am disabled. I have human needs. My needs will improve how much I can quote unquote produce for society. But yet I'm told that I'm the burden. But yet, like, a pregnant woman isn't seen as a burden, so there's a stigma attached to that. And I think whether it's, you deal with it in different ways, whether it's invisible or visible. You know, your disability is invisible or visible. And then we have our internalized shame and our internalized ableism. And this reality that we don't yet, in America especially, we don't yet see disability as a normal, natural part of the life trajectory. We see it under the public health lens of it's a failure. There's a stigma, you are a burden, you know, and then the programs that we access end up making us even that much more of a burden because we're always rubbing two nickels together thinking we're going to suddenly become comfortable, not even rich, but comfortable and safe, which is that cortisol response when you're not safe is just messed up. So my ongoing call to disabled people is embrace your needs because they're normal and natural. Stop worrying about what other people say, because we need you, Joy, as the powerhouse you are, to be in that role. And when you need it, use it. When you don't need it, don't use it. It's as simple as that. There's going to be drama. Society hasn't yet caught up with this thing of disability being a normal part of life experience. They want to blame us. They want to do all this other stuff. But what we need to do is just move in those spaces and show people how we can be. If you meet my needs, if JB, I'm sure with you too, if you meet your basic needs, we can all do so much more, you know. But when we're parsing it out and saying, oh, you're not producing enough, and the way you produce is not right because you're drooling right now, you know, and their discomfort with their abled fragility, which is what that is their discomfort with whatever I need. My use of a chair, I see this a lot where people react to me being in the chair with a fear response because it's kind of big and I'm kind of big, and I can understand I can break a foot with my chair, but you know, it's that ongoing thing of their fear is not my fear. And we just need to meet our needs, and it's hard to do that sometimes in the structures that we're in.
Yeah, absolutely. And I know, Michele, one of the things we've spoken about before is ADA, and I know you've studied up on that very much. You know, both of you have been, you know, in this longer than I have, but 2 years, and I am just blown away by, oh, the ADA, it's supposed to be this magical thing. They have it set up so that, you know, there's no disparities within people with disabilities. And I'm learning that the one place I literally went online to buy, it was prescription. I had to get one of my reading devices online. They made me do a CAPTCHA or whatever the hell it is to get my reading device. So you are telling a blind person who needs a prescription to get a specific device that they have to pick out the freaking traffic lights before, like, I had to wait till my husband got home. Like, what if you don't have someone else? What if, you know, or things like, you know, ramps. I've seen so many places that don't have ramps, which I thought was illegal. I thought it's supposed to be, but it's my understanding the ADA hasn't even been updated since its inception, correct?
No, it has. It has been updated. 2010, I think, was the last major update. And then there's a lot of other microparse little rules that get put out in like building codes, employment law, different things like that. But the thing that this goes back again to the ADA, the ADA was passed for a specific reason to hopefully improve the equity for, well, actually, it wasn't even about equity. It was about rights of mostly white disabled people also, which is part of the problem in the framing of it. But it was our responsibility. It's the disabled responsibility to police the businesses, the health companies, all this other stuff. So when you're having to do that, they don't have to do anything unless you make them do it. I'm sorry, I don't have the energy to survive sometimes, so I can't really push you into doing the things that you're supposed to be doing.
Yeah.
It's a lose-lose. And then there's a fear reaction too with the ADA. When you go into a business that has been in business, and it's, say, a mom and pop place, and they have a fear response because they're afraid you're going to sue them. And that lawsuit would cost them a lot of money and potentially closes places down. But usually disabled people, and I'll say this for more physically disabilities myself, the way I deal with society is it's only when there's an attitudinal barrier that I'm really pissed off. When you're failing to at least acknowledge I'm a human being and you want to push me out of your store and make me go away. It's a mess. The whole system's a mess.
That's kind of wild though, because it's like we have to police, businesses for ourselves just in order to be able to get access. And it's like, wait a minute, why don't you have people within the bureaucratic process that do that?
Mm-hmm.
I mean, like, what do our federal dollars go towards? And it just makes me upset because, like, there should be inspectors that go to buildings to go, okay, so is this ADA approved up to code? If not, then you guys need to get this done, or we're going to have to shut down because, lest someone who is disabled tries to come in and they can't, or there's a hazard there that prevents them from truly being able to access the business.
Mm-hmm.
And even then giving subsidies to businesses so they can put a ramp or put these accessible things for people who are disabled. I'm not saying that put it all on businesses. I'm saying give them subsidies so that they can do that.
Yeah.
Yeah, and I think transportation is something that I find is, I can't drive. So,
Mm-hmm.
when I use an Uber or Lyft, it got to the point where I literally type in the comments, I am visually impaired. Because what would happen was I would get one and they would come out to get me. And the person would literally get out of their car and be like, I'm right here. And I would it would upset me, and because I'm still self-conscious, this is all still very new to me.
Mm-hmm.
And I'm like, okay, if you are driving people for a living, why do you not acknowledge the fact that maybe some of them might have health conditions, disabilities, whatever, but it made me self-conscious to the point after it happening numerous times that I just put in the comments, visually impaired, may not see car, I'm wearing XYZ, please pull up. And it's like, again, that that onus is on me. Like, it is my responsibility somehow to be like, check yourself.
And you have the added complication that you can also be turned down by Uber and Lyft drivers if you are disabled.
Absolutely.
So by disclosing that, you're also running a risk of them saying, oh, I don't want to deal with her right now. I can go take this other person.
Absolutely.
Yeah.
Absolutely. One of the, also with transportation, have either of you dealt with anything as far as, buses, trains, anything like that? I mean, Michele, you're in a wheelchair. I can't even fathom, like, what are some of the obstacles?
So I actually had to buy a car during the pandemic. I had to buy a wheelchair accessible van because of a lot of the fear factor and the exposure and COVID and all this other stuff. The cleaning of vehicles, the paratransit system is woefully inadequate. With some states, they have their Medicaid program will pay for transportation. I have a funny story for that if you really want to hear it, because I was in the hospital, they arranged for transport home. I had my chair with me, and they just called the medical transport company without telling them I had a wheelchair. So they had to lift my wheelchair up into a second ambulance transport vehicle And my chair weighs like 300 pounds because it's a complex rehab chair and all this other stuff. And this was done in a hospital, mind you.
Oh my God.
So it's like, okay, I'm supposed to rely on this system that doesn't help me very much. And it forced me into a point where, and I'm currently struggling because I also lost my mother recently. So, I'm struggling to make ends meet because my mom was still here. We bought this van. I loaned it out to the hilt because wheelchair accessible vans are $60,000, used actually. So, here I have a 10-year loan on a van, and my mother passed away, so that income stream's no longer here. And it's always this balancing act. So it's not one thing or the other. It's that you have to fine tune your balance. Because any day being in a wheelchair, I go to my medical provider place during COVID, they had barred the wheelchair accessible entry point to put their COVID clinic right there for COVID testing. So I actually had to file a federal complaint, civil rights complaint against the building, against the company, very well affluent medical care place, facility, comprehensive network, whatever. They could not figure out why they were blocking me because they needed the space. They didn't want to think about me. They didn't want to think about disabled access because, you guys can do virtual, whatever, So these issues are all complex. But I go into my medical provider, they have their cart in the wheelchair seating spot. So I have to go take up 3 chairs, which people look at me sideways for doing, in order to have a space to be out of the way, more or less, or at least not having people run into me all the time. So these are all variables, and I may have garbled that. I'm not sure about the clarity of it, but these are things that you deal with, but yet they're not solely for physically disabled people that we encounter these things. Because I think I encountered some of these things with the attitudes when I was predominantly just dealing with mental health stuff. It's like the barriers are still there. It's just, and then how we look at the barriers is whether we end up coming out empowered or come out, subjugated, basically. So
Yeah,
Absolutely. And oh my gosh, on that, before I get to JB, oh my gosh, like, why does this stuff even shock me? But that is mind blowing. Also, let me just say this before I forget. If you are like a young or healthy or able-bodied person and there's like 20 seats open, can you get the F up off the damn handicap seats? Can you not go in the damn handicap bathroom? Can you just like start being more conscious of the fact that like some people actually need those things? So if you're at the movie theater and you want to sit up front, sorry if those seats are full, etc., because it's not meant for you. So leave these things available for the people who actually need them. I just needed to rant because I've seen, like elderly people with walkers get on the train and have to stand because there's like a 16-year-old kid sitting there listening to his headphones. And I'm like, get up. What's your problem? So you see stuff like that. GB.
So I just want to reflect a little bit with Michele, what she said about oh my God, transportation. When it comes to, I'm forgetting for some paratransit. For some reason, I couldn't remember the word. But when it comes to paratransit, for me, I'm what they call ambulatory, meaning I can walk, I can climb stairs, blah, 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 just whatever. But for me, the barrier is cost. And I have to pay a copay each time I get on just so that I can get to and from dialysis. Mind you, for some reason, there's a barrier where I can only do it for dialysis and dialysis related things. I can't use that same paratransit transport to go to the store. I can't use it to go to shop for things. I can't use that transport to go to different places. Like, say if I got a job and if I wanted to go to work, I can't use it for that.
Mm-hmm.
So it's like, well, why? And it's like, well, that's just how yours is set up. But people don't realize the cost barrier that it is, especially when disabled people who receive disability benefits don't receive hardly anything at all. By the way, also, Michele, if a hospital set you up with transportation and didn't tell them that, that you were in a wheelchair, that was them dropping the ball, completely all their fault. Because guess what? These people are supposed to ask, when you're setting up the appointment, is the person ambulatory or are they in a wheelchair? And if they say they're in a wheelchair, then that means it's up to them to schedule the proper vehicle to take you in a wheelchair so that they can lift you and put you inside the proper vehicle. Because that didn't happen, that was their fault. So guess what? They can suck their teeth and they can moan all they want, but guess what? It was somebody else's fault they dropped the ball. I just wanted to put that out there because I was like, because that got me mad. I was just like, no, you don't do that, Michele.
Yeah, it's mine. It's like, but I know so it's not just solely, it wasn't the driver's fault. It was the admin person in the hospital. It was definitely their responsibility, their lack of information share. But I've known people that are disabled, they use a wheelchair, they get admitted to a hospital for whatever reason. And the first response of the nurses is, oh, let me move this for you so that we can have access to your bed. Talking about the wheelchair. It's like, my wheelchair is an extension of me and you need to not touch it unless I absolutely do not need it. If you're taking it away from me, you're taking away, in some situations, the ability for a person to be autonomous. And the autonomy is where we get our power. The autonomy is where we can do more, because we can make the decision on how we do it. And we can do things in ways that most people don't realize, but we just do it a little bit different. I rely on an in-home care provider, and it's like, I'm fortunate, I'm lucky. I've learned how to move in these systems that require almost a freaking PhD to start moving in anyways. Where I work, I teach the interns and young kids how to read an insurance paper, how to read what this insurance policy is going to cover, and to know when it's not going to cover you. But that's not a skill that's learned everywhere, and we shouldn't have to. Why are we wasting our energy on that when it's beyond time for us? Because not having a unified plan is what's killing people, and it's killing people everywhere, and it's also further disabling people, and it's just complicating our lives in ways that we don't need. But we just need the single payer healthcare.
And a lot of times, like, it's because my disability is invisible and you can't necessarily see it. My disability is time and energy sensitive. And so a lot of times people will think you're just lazy. And it's not necessarily feeling lazy, it's chronic fatigue, as well as being able to do things at certain times. Like, for instance, somebody's like, oh, well, you can do this on a Monday. No, I can't, because I have dialysis on Mondays. Basically, I have to go get my blood clean, whereas you, who are a healthy, able-bodied person, guess what? You're constantly going through dialysis as we speak. Yes, you who are watching right now, you're literally going through dialysis right now because your kidneys are working. Mine don't. So I have to go 3 times a week in order for that to happen. And just as another note, and you guys can clip this so that when people see this, then they know. Just because you're not disabled doesn't mean this information is not important to you, because one or two things are going to happen to you. Either one, you're going to become disabled as a young person, or two, you're going to get old. And you're going to need this system, and you're going to need this information anyway. So therefore, I suggest you sit your ass down and continue to watch this video, because just because a couple of disabled people are talking does not mean this does not or will not apply to you in the future. Because guess what? Disability happens either one of two ways. Either it happens either from a health or accident, or it happens from old age, and you're going to have it one way or the other. So please continue to listen. And if anybody you know is, that you want to share this information with, please consider sharing this information on social media, emailing it to people, or what have you, because this is pertinent information for every single human being, because that's just what we need to happen.
Absolutely. And I'm sorry, continue.
And I'm just saying that, for a lot of us, people, they don't keep these things cognizant when we voice these things. And we may, and I know that as a person, I have to be careful with how I voice things, because I don't want to come off as extremely pushy or rude. But at the same time, realize that when we're voicing these things, it is deeply important, especially when we tell people about our limitations, because when we don't, because when they don't listen, then they're sit there going like, "What's wrong with you?" And we're like, "Look, this is what's going on. You have to be cognizant of this, because if not, then you really can't deal with us. And in order for us to function in society, and if you have to deal with us." So that's just what I want to say.
Absolutely. And on that, I kind of want to bring up this point. When I was in high school, our health class, or whatever you want to say, we never talked about disabilities ever.
No.
Like,
No, we
never even mentioned it. And, needing a cane for the first time, it's a white cane. Most people know white is for blindness. I'm telling you, when I bring my cane places, kids literally step over it. Literally, don't walk out of the way. They step over it. I've bumped into kids, and people, but kids so many times, because I'm just walking. They're completely oblivious. They just stand there looking at me, and I'm like, parents need to teach their kids about disabilities and about being aware of these things. Like, I try to tell kids when they stare or they do stuff like that, white cane means blindness. Please be more cognizant of your surroundings. But we don't learn about that in health class. So really, it comes down to the parents. Parents need to educate their children. You may see someone in a wheelchair or with a cane or what have you. And we just need to do a better job as Americans by educating people that not to stare and to be more aware of their surroundings. So we can go around again. Michele?
I think that there's a lot of cultural variables in play when you start to be a disabled person out in society. For me, I'll be going towards somebody and they pull their kids closer to them because they're afraid, that fear response. Also, I don't know what it is, but when I first got in the chair, it was like I could not figure out which way people were going to walk, because they'd walk and they'd see me and they'd shift, and then they'd walk right by me, and I'm like going, if you guys just would let me go, I'd be fine. Just ignore me. Just pretend I'm not here. Yeah. So there's that, schools, that we have to also remember, the disability funding in schools is not 100% funded. And there's a segregatory system that still exists that keeps the undesirables, those with different bodies, different minds, different whatever else, it keeps us in a closet. And it's like, it's not normalized. It's not, it is still the sign of failure in public health that you're disabled. That's checked. We failed as a society. And we failed not just with this one person, but this X amount. Now, I wish they actually looked at that and considered it, because maybe we'd get change, but they don't look at it. They don't consider it. It's like, oh, you're the failure. I'm not the failure. You're the failure. And you're too tired and you need too much and you do this and you do that. But and we have to educate ourselves and educate other people. And it's a never ending struggle because we're already in a system that's stacked against us. And I think that's the never ending struggle. The stigma attached to the human needs that we might have is huge. It took me years to deprogram my mind to where I wasn't embarrassed that I needed an in-home care person. You know, it took me years to reach that point. Through my work, I realized if you have a community that does collective access, your world changes. You change in a way that I couldn't. I mean, I always blamed myself for my mental health stuff. I didn't realize that my mental health stuff actually stemmed from a disconnect from a community of care or community of support. So it's like, but that's what the cult of individualism in the United States says, is we're all responsible. It's our responsibility to do everything, to meet the needs of everybody around us, and to bring home enough money to support ourselves. We have to shift from that. We really need to realize that disability is a part of life. And if we plan for those most at risk and most impacted, we can actually make it better for everybody. We'd be done with the pandemic right now if we actually listened to disabled people early on. If we actually met those needs, we would have met everybody's needs. So.
Yeah, I just wanted to add something. And to anybody that's watching right now, let me ask you a question. Those of you who are able-bodied and, have the that do not suffer, well, I shouldn't say it that way, but do not have a intellectual disability. Have you ever been in class with someone who just physically they had a disability? They were in a wheelchair, they were in a walker, something like that. I'm because typically, kids who have intellectual disabilities, they're in a different class, things like that, right? But what if you are just physically disabled? Have you seen that person in the same class as you? Have you seen that person in a wheelchair in your class or in a walker in your class? And now you're asking yourself that question. Why? Because I know people who are in wheelchairs and they're neurotypical, and yet sometimes I'll see them in school, but they're never in any of my classes. And it's like, why? Because mentally we're all, at the same level. We're at the same thing, but for some reason, you never see us around them. And then you start to realize that the system tends to take people like us and moves us to the side, moves us out of the way, right? And so it's something to think about, I remember when I was in 5th grade, I had my 5th grade teacher, Mrs. Youngblood, really sweet lady. She got into a car accident and it affected her legs. After some recovery, she was still in a wheelchair. She came back to our school in a wheelchair. Guess what? We took care of her. Whenever we went out to recess, whenever we went to lunch, whenever we went to the bathroom, whose turn it is to, we would all fight for a turn to push Mrs. Youngblood in the wheelchair down the hall. I think that's something that we all should have, like a kind of mentality within ourselves to look at it as a privilege to help take care of people who might be disabled, who might need some more help from the community. Because when the community comes together, then we all thrive, just like what Michele said.
Absolutely. I want to kind of switch gears a little and talk about, the way people are othered as well. So, Michele, as a fellow woman, how do you think that how gender plays into, being disabled? It's like inequities on top of inequities type thing.
Yeah, there's always that intersectional oppression. And for myself, I have multiple places of identity that I end up encountering barriers because of those identities. You know, I identify as queer, I'm disabled, I am a woman, and I was raised poor, you know, which gives, and I'm still poor, you know, thanks to the systems that we occupy. So with all of that, you get more and more of a what I call a muddy mess, basically, because it's intersectional oppression is kind of like mud wrestling because you don't ever know what you're going to hit when you hit it. But um, you know, as a woman, I think I've dealt more with paternalism with my disability. You know, the things where people are like, "Oh, we don't see your disability because I don't see your chair." Like, yeah, you do. You see my chair. And I used to think that was a compliment. I'm like, oh my goodness, this guy values me for me and not because I'm just in a chair. But then I realized, no, that's not the case. He doesn't understand this yet. You know, he doesn't do whatever. So that caretaking. The other thing that is a never-ending struggle is within the healthcare system as a woman, as somebody with complex medical needs, as a fat person. You know, all of these variables, they'll tell you to lose weight instead of treating a cancer. You know, they'll tell you that you just need to relax and do deep breathing instead of dealing with a genetic condition that may actually make your blood pressure crazy and you need to be medicated. You know, so it's like, as a woman, there's a lot of gaslighting that goes on. Our government's been huge with the gaslighting throughout COVID. I'll say too, but it gets to be messier and messier as you start to deal with the different variables. The other reality is, as a woman, you make less money than most men still in today's society. I'll say Black and brown people definitely make even less than white women. You know, so with all of that, you end up with the disabled tax on everything. That is, if you need a special mattress, you have to pay not the $600 or whatever dollars for that mattress, but it's suddenly $1,800 or $2,500. You know, insurance is baked in a way that when you get durable medical equipment, they charge you monthly for the first 11 months of your rental period of that equipment. And if you color outside the lines ever, you know, it's like, oh, we'll take that equipment back now, you know, kind of thing, which you just compromised my life. But the other piece is it's like, as a woman, it's like, oh, you don't really know what you need.
What? These people, do not let me be standing next to you and they tell you that. No, because they will be hearing from me. Oh, hell no. No, you do not sit there and tell a woman what she does and does not need. Because the thing is that women are some of the greatest communicators in the world. And so if they tell you what they need, then you better goddamn listen to them. So that's my thing. Like my mother will tell me what she needs. Okay. I don't have to ask. I don't have to wonder. She will tell me. So guess what? They're going to tell you what they need. So if you just listen, then you'll know. God, paternalism and this patriarchy is such. I'm sorry, but I hate the cuss on this, but that's some bullshit.
It is bullshit.
All right. I'm sorry. I cut you off. I'm sorry.
You have done enough shows with me to know I'm okay with cursing.
Yeah.
But
it just makes me mad. I'm just like, and I want to go up to other men and be like, dude, what are you doing? And then on top of it, being disabled at the same time. And you're just like, what? Are you kidding me? It's like, grow some empathy, bro. Oh, it just irks me to no end.
And I get it though everywhere. Sorry, I get it everywhere.
As a person of color, what is your take on these things? What have you noticed dealing with your disability and how people are receptive to you or not?
Because it's invisible, it's not as prevalent of an issue for me. On top of having male privilege, I acknowledge that I have it. It's not as talked about. But then I like what you said, Michelle, about when people say they don't see your chair, but they don't really see you. They don't see that part of you that's disabled. They are not acknowledging that part of you. It's just like when people look at me and say, "Well, I don't see color." I just don't. And it's like, "Well, you don't see my identity? You do not see that I am a black man that's operating within this world, especially within this country?" It's like, yes, you need to see that. Joy, whenever you have your white cane, they need to see that because you're operating within a world that tries to see you as othered, or they want to see you out of the way. So, yes, see it, recognize it, and do not push us out of the way. Look at us, you know, because we are in your tribe. We are in your community. We are members of that community, no matter what. And so it's that's the one thing though that I can say that I guess I'm kind of grateful for, is that because my it's kind of a catch-22, because they don't see your disability, so they think you're quote unquote normal, but then they do see your disability, and then they either sometimes forget your limitations, because sometimes the people will want to have a full-on conversation after I get off of dialysis, and I'm like, I'm sorry, I just can't do it because I'm exhausted. And the funny thing about being on dialysis is that sometimes mentally it'll affect me, where my brain will become very foggy, and I'll start forgetting words. Like I forgot a couple words earlier today, and so the exhaustion and fatigue happens. And so it's difficult, and sometimes I'll get asked to be, on a panel on a dialysis day. And so I'm just like, I'm sorry, I have to decline, but I can't expect everybody to remember my dialysis days because, they can't remember. But, it's just, you have to continuously let people know. You have to remind them all the time of your disability, versus somebody who has a physical disability. They don't have to remind people that much. So it's kind of a catch-22.
Michele, I see you.
I was going to add too that so there's a hierarchy of disability within the disability community. And then I'll also say there's a hierarchy of disability outside of the disability community, in the sense that people, they're not supports for people, and those supports often are not necessarily medicalized, in the sense that you can use insurance to pay for this service or that service. Or there's so much gatekeeping that goes on that you have to, I recently qualified finally for an insulin pump because I'm a type 2 diabetic and I've used insulin for a number of years. I've always been well controlled, but it was a 6-month process to get approved for an insulin pump because of one blood test result that came back abnormal, that they then said the doctor didn't order the right test result, so I had to repeat it. And the second time it came back just barely into the normal range. So these hoops and loops and the hierarchy and all of this other stuff, it comes together and it creates a lot of complex situations and complex realities. This is ideal. This panel right now, because we have somebody with a physical disability. Joy, you've got the vision, a vision related disability. JB, you also have a chronic health condition, and we're representing 3 different perspectives and 3 different realities, that when people think about disability, they think one size fits most, and no, I'd say you need more facets than a diamond in order to make things work for most people. And then you deal with a disconnected network technology for blind and deaf individuals, or low vision and deaf and hard of hearing people. There's not an interconnectivity from one device to another device. If you don't do everything completely right, you've then created an inaccessible document. So how do we It's complex, and when somebody's disabled, there's the other part of it. Oh, you're just angry today. You're angry. It doesn't matter. You're angry. I'm not going to talk to you right now. And you get this angry crip thing. And I said crip as in cripple, whatever. You get this angry thing, and they're like discounting you and diminishing you just solely because you're pissed about something, and technically 9 times out of 10, very, very justifiably pissed at somebody, because they've failed to provide access, and they likely have put your life in jeopardy as well in another way. So it's hard.
You know what? It's interesting you mentioned that, Michele, because a hierarchy among disabled people, because there are more disabled people than people realize.
Yeah. Oh yeah. The statistic for this session was like so not right.
Yeah.
I mean,
Yeah. Okay. So here this, people. I want you to come to the camera. Come closer.
Oh, here it goes.
Closer. All right. You want to know something really interesting? If you're wearing glasses, you are disabled. Glasses are a visual prosthetic. Did you know that? So there are a lot more disabled people in this world than others. It's just having a slight visual impairment is looked at as more normal than anything. See somebody with a pair of glasses, you don't see anything different. You see them as a normal person. You don't see them as disabled. But guess what? They are, because they need that visual prosthetic in order to see. Now, if that person does not have their glasses, then you start to see how disabled they really are. And the thing is that, and look, there's a huge industry behind it. In fact, there's one company that owns like an umbrella company for all the other glasses. And then the person wears, and then they have in different fashion designs, and people say you look sophisticated. You're basically saying that because they have a disability and that they're using a prosthetic, they actually look sophisticated. So realize that you may be already in this community and you don't even know it. So guess what? This is one of the reasons why I also said to make sure you pay attention to this program, because it's deeply important. And this is one of the reasons why we're advocating for a single payer universal healthcare system, or greater, as in my case, what I would like to see is a national healthcare system. Because that means every single time you need new glasses, you need a new prescription, guess what? Who has to pony up the dough? You do. And then should your impairment of vision have a cost barrier for you to see? Is that right? Should your impairment orally be a barrier for you to get either dentures, partials, or implants, or get your teeth cleaned, or get a filling put in? Should there be a barrier? Should your condition, that gives you either bipolar disorder or schizophrenia or depression, should there be a cost barrier between you and getting that regulated for your mind? If your answer that no, there should not be a cost barrier, then guess what? This is one of the reasons why we should have the same exact system, well, not the same exact system, but we should have a similar system to all the other developed nations across the world. I think that it's the humane thing to do.
It is. Anything less is violence. That's the only way. It's the only term, violence. And if you guys have not seen it, any viewers, last night I shared an exclusive interview I did with Larry Sanders, Bernard's brother. He was the healthcare spokesperson for the UK Green Party. So we had a really amazing discussion about the NHS. And then afterwards, I showed a video Cavernacle, commentator from the UK, made for us about his experience with the NHS. So National Improved Medicare for All is here. And NHS is here. And we're going to have to keep fighting regardless. I mean, this will never be over. But at the same time, this needs to happen, period.
Yeah.
Like now, not
Yeah.
state by state, not incremental, not means tested, not all that stuff. Now, everybody in, nobody out, period. I also want to talk about Social Security disability. I recently went through it. Holy shit.
Oh,
Oh
yeah.
my God. That in itself was traumatic. So you become disabled, and the disability, the trauma of the disability is exacerbated by filling out 18,000 pages of paperwork.
Yeah.
Written this big, mind you. I'm like, that's a kind of ableist in itself. And
Yeah.
you are raking up doctor bills, mortgage, everything in the meantime, because even though I had insurance the whole time, what does that matter if I have literally zero
No
income?
money.
Because
Mhm.
you can't have income when you're applying. It doesn't matter if it takes 5 years. You cannot have it. So I went through, it was 19 months. And blindness is supposed to be one of the things that's like, but they were fighting me on it. They were, and then after everything, after 19 months, I finally got approved. And they said, well, there's a rule that it doesn't start for 5 months after you're approved.
6 months.
What the hell does that mean? So then you wait even more bills, more everything. And then I didn't get any back pay. So that is not truthful when people say, well, you get that money back. I didn't get any back. Why? Because they tried to say that my blindness occurred the month that I got approved, not 2 years ago when it actually happened. And when my doctor stated it happened, when the medical documentation showed it happened, when my surgeries actually occurred, not then. When I was approved was apparently when it started.
Wow.
So I got zero back pay. So all that money, bye-bye 401k, you don't know what to do. So you just do anything necessary. Thankfully, my husband works full-time, but it was hard. I mean, 19 months. And plus, I'm one of those people, I need to work. I need to feel I'm contributing. My husband was like, it's okay, I'll take care. No, we have been 50-50 for 13 years. I need to be 50-50. I cannot do this. And it used to keep me up at night that I wasn't contributing. I'm just not that kind of person. I don't want to be like that. But you're in that position where you're like, I either stop applying and just take some kind of job that's not going to judge me for being blind, which good luck with that. Or I just keep trying to wait it out. And 19 months isn't actually as long as many people wait.
No.
You are put in this violent situation with, sorry, you have the trauma of going disabled, but you're also kind of going to have the trauma of having, tons of medical bills, even with insurance, and the fact that you have to keep fighting to even get disability. So I kind of wanted to get your takes on that, what you have experienced in that process.
Yeah. I was fortunate when I got disability in that I had people that directed me to the resources that I needed to be directed to help kind of expedite the process. And just to be clear, being on Social Security disability is different from having an identity of being disabled. Social Security disability is a social network program. It's a support. It's woefully inadequate. It's all this other things. Doesn't matter if I'm on disability or not. And this kind of goes back to what JB had said before too about, hey, people, listen, because we'll all experience disability at one point or another. And if you're not experiencing it, there's somebody in your network who is, you know.
Mm-hmm.
But I helped my mom also apply for disability when she became disabled. And they told her she could still do her job. She was sick in bed. She had recurring shingles. She has lupus, Sjogren's, a whole bunch of other, you know, autoimmune issues, psoriatic arthritis, you know, whatever. And they said, oh, but you can still do your job. So you're not disabled. So then we had to push and push and push. But the thing about this too, the other thing is it took me years to realize it wasn't my fault that I panicked every time I got my damn forms to fill out to justify again that I was disabled. To these people, even without working, without making what's called substantially gainful activity of employment, you know, even without all of those things, it's those forms would throw me into a panic attack beyond, and I would just shut down.
Yeah.
And there were a few times shut down to the extent that I had to check myself into a hospital, a mental health hospital, because I became suicidal and overwhelmed, and, you know, I needed the extra supports. But they're scary. And during the last president, there were initiatives that were getting put forward that were even more scary about mandating those forms again on an annual basis for certain people over others. And you can bet that these people weren't doing anything fraudulent,
Mm-hmm.
but they still needed their benefits, you know, but the government wanted to knock them off the roll. And then what are we to do? You know, because for most of us, it's not like we're gaming the system. They don't give me enough to game the system on what they give me. So
Yeah, they don't.
yeah, but you know, and it's the education level, the awareness level. Disabled people are not on the radar. It should be, everybody should be on the radar, but disability is still, most people on disability, even those with blind or low vision, they did not receive the same amount as people receiving the extra $600 a week in their unemployment checks for most of the pandemic. And let's remember that I'm not disabled by my body. I'm disabled by society and the structural barriers and the things that exist.
Mm-hmm.
So my disability is impacted by what everybody else does more than it is by my internal process, because I have some control over that, you know, or I have some semblance of a understanding of that. But disability, the whole program needs to change. It's inadequate. It doesn't meet the needs. And then you also are gate kept. If you're not on disability, if you're not eligible for Medicaid, Medi-Cal in the state of California, you then either have like way huge spend downs on your share of cost and or spend downs, but you're not eligible for in-home services. So the never-ending struggle, especially within the Medicare for All movement, has been to make sure disabled people are in the room, to make sure disabled people are informing the policies. I think it was Bernie that finally started to add some of the home and community-based services to that. Everybody benefits from home and community-based services. We need to get over this thing of it's only disabled people that benefit from this, you know?
Mm-hmm. Yeah, this whole thing, it's clear that when the ADA, you know, not the ADA, but when disability benefits were created, were there any disabled people actually in the room when it came to the processes of getting these things done? I don't really think they were. I made a tweet of, what was it, over a week ago? Yeah, it was a little over 2 weeks ago. And I asked this question on Twitter, and I'm gonna read it right here. I said, question: why are people who receive disability benefits not automatically enrolled in Section 8?
Thank you. Easy solution.
That's a question that I'm asking. I ask people. Look, I got almost 1,000 likes just from this one. And the crazy part is, it's like, okay, so when it comes to what a true living income is, you don't give it to us on disability. I get the equivalent of what would equal to $7.50 an hour per month. That's it. Yeah, that's it. If you take what you get on disability and then you divide it by 160, which is 40 hours a week, Four times a month is 160 hours, and that'll give you how much you get. With that being said, I know what it's like to lose your disability because you're trying to supplement your income. And I lost my disability back in 2019 because I tried to get a job. I had a job and I tried to supplement my income because it just wasn't enough. And come to find out, because I didn't know this, that if you make 1 penny above the approved amount that you're supposed to earn, then they take your entire disability away completely. It's not prorated. It's not anything like that. It is your entire thing away. And so guess what? Your entire means of survival, your primary source of income, gone. And so I panicked. I had to create a GoFundMe just so that I can help make the rent, right? Because my mom, she's also receiving just Social Security, and myself, and that's it. We don't have enough to live on our own. And so I had to do that. And to this day, I still have a GoFundMe just to help out with, daily expenses, just so that I can survive. Because Social Security disability is wholly, when we say wholly inadequate, we're meaning that even if it was the equivalent of $15 an hour we get a month, that would be a huge boom to us. It's not even half of that for some of us. We are literally living in poverty. And some of us, we try to work and then, we can only do so much. Or some of us, we can't work, or it's very difficult for us to work because we have a time sensitivity or an energy sensitivity. So it makes it even more difficult for us. And people say, oh, well, you get free money from the government. It's not free, because if you pay taxes, it's not free. And one more thing. When it comes to the disability benefits that we get, because they're wholly inadequate, here's the thing that I hate. Did you know that the people that you are only, if you're only taxed on Social Security tax income up to I think it's $143,000 of your income. So if you make more than $143,000, the rest of that income from that does not get taxed for Social Security disability. Now, we do know about MMT and that they can just, pay for it. We all know that. But there's an unfairness in the system when, if you have somebody who's a billionaire, they have all this huge, copious amounts of money, and they don't get taxed on helping people who are disabled. So it's just,
Congress makes more than that. Coincidence?
Yeah. So only on the first 143,000 do they get that Social Security tax.
There's been an added complication, though, in the last few years for some people that receive disability, which is what their Medicare premium actually is. And
yeah,
then
I have
there's,
to deal with that.
yeah, so it's like, I have one friend that her Medicare premium, because her partner is still working, literally guts like a third of her disability check every month. So it's just so high and so inadequate in so many ways. I have another person that went $20 over the income levels for qualifying for Medicaid, and they made her spend down $900 a month for being $20 over qualifying. She was supposed to pay $900 each and every month before the insurance would kick in.
See, that's where I used to work for medical assistance, and that's where I legit used to tell people, call out for a day. before they apply, because they would get turned down for like $5 over, and I'd be like, yo, take a sick day, legit.
Mm-hmm.
And I may have gotten let go because I got caught saying stuff like that a few times, but oh well. It's truly incredible. So, we just addressed some of the misconceptions people have. When you're in Social Security disability, no, you do not get free healthcare. No, you do not get free services. No, you do not get any kind of stipend for any services you need, which is, even, transportation or anything you need. You are absolutely still responsible for all of that. And also, like JB said, it's not that people on disability don't try to work. Look, I've been trying to get a job for 2 years. I've been trying. Nobody wants my ass. Like, I can't even do retail because I can't see the keyboard. Like, I'm trying, but in my state, they don't have to give you accessibility for blindness. I was working in healthcare in an office setting. They don't have to help me. That's how I legally lost my last job, because of my blindness. And I was a contractor. They were completely allowed to just, sorry, you no longer are up to our standards of words per minute and XYZ. But I sat there for 3 months like this, holding the keyboard up, trying everything, to keep working. And then when I heard someone walking, I'd be like, and just try and hide it, because I knew I would get fired. And that is legal in so many more states than people realize, especially with contractors, temps, things like that. There are, nothing is in place to help people. That is it discrimination? Of course it is. But is it illegal? No.
And that goes back to the burden being placed on disabled people to police when these things happen. The fix for the civil rights suit that I filed with the government, with the US government, actually the fix to that was literally the location had to open that zone up again. They had another fix that they could have done that would have ensured accessibility to the site for the rest of time, but instead they shut everything down. They moved the testing site someplace else to open up that pathway again without having to fix anything. They didn't have to change anything. They even had a sign that said, if this is not a disabled access, you have to turn around and go back. But none of the staff in that building knew how disabled people were, wheelchair users would enter the building. So these are ongoing struggles that the system is so set up against us. It's hard. And we're seen as the burden when it's like, literally, if I didn't have to prove that you just discriminated against me, I could have this job that I'm more than qualified for, but you don't want me around because your office is packed too full and my wheelchair wouldn't easily maneuver. And I mean, where I work now, I've created a space, but yet like yesterday, I broke my copy machine. So I spun around and I hit the copy machine and I kind of shattered part of the front cover. It's cosmetic, but it's still, I do that. Because society's not built in a way, even when it is more structured in a way that will meet my needs, it still is hard. And there still are these realities of things that happen. And the discrimination part is spot on, because you have to prove it. It doesn't matter that it happened. What matters is if you can prove it.
And just another point I wanted to tell, and this isn't necessarily going after any particular politician, but this is something that I want anybody who is listening to this to keep in mind. In 2020, Bernie Sanders had a disability bill that would increase the amount that people on disability got, and it worked out to about $200 more per year. $200 does not help us that much per year on disability. If you truly want to give disabled people a better life, you would make it at least equivalent to that of a living wage. Because there are a lot of us who, look, all right, real talk, I'm 37, almost 38 years old, and my mother lives with me. I love my mama. But at 37, 38 years old, I would like to have my own spot. Now, either give me a subsidy so that I can be able to have my own place, like Section 8, or raise the benefit rate of Social Security disability. One of the two. Because, and then I don't want to hear people say, oh, well, it's just too expensive because we can't do it. No. You guys got enough money for those wars. You guys just approved billions of dollars to send to Ukraine, but yet you can't approve the money for us to have, a living income on Social Security disability. So no, I don't buy it. We actually do have enough money in this, and I didn't get to the $4 trillion that was spent during the beginning of the pandemic to prop up the stock market. But I digress. But still, like, if you're trying to make life better for those of us disabled, please go well beyond that $200 per year, because it definitely wasn't enough. And yeah, Bernie was somebody who did it, $200 per year. And there's many other politicians who were saying that, oh, we'll raise Social Security disability benefit. It's not enough.
I want to
didn't know that. I'm going to have to look into that. I had no idea about that bill.
Yeah.
I want to also state one other thing, and part of this is tagged on to listening both of you talk too. The system is working the way it's designed to work, because the US is based on eugenics for disabled people in typical. In general, when you're disabled, you're so othered and so far on that trajectory that there's so much eugenics, racism, and capitalism are baked into our systems. So the system works exactly how it's supposed to work.
That's true.
And that is to kill me, because I am not valued as a disabled person. Mm-hmm. And trust me, there's good reasons for people to value me. There's some that they probably want to push me aside and make me go away. But, it's important that every person in the United States is valued as the person that they are, and the systems need to change. And it's going to be a hard and tumultuous process to changing those systems. I've been able to witness it somewhat here in my county through, getting a disability equity and inclusion pledge adopted. But because disability rights is not disability equity. And we, as disabled people, we also have to realize that. What do we need for equity? Mm-hmm. And equity is important. How many DEI, diversity, equity, inclusion, and my cat was kind of trying to use my leg there. Diversity, equity, inclusion things fail to include disability. Mm-hmm. And it's hard every time those doors are shut, every time it's slammed in my face that it's okay that you're disabled as long as you stay in that corner. Mm-hmm. And you eat the food pantry food and you deal with whatever it is that you're given, and be thankful for that. Thank us for that ADA accessible toilet that we made in 2020 that you didn't have before then, and these things are the things that everybody needs to stop and realize, that the system that they love, the system that they see so much value in, is killing me. It's killing disabled people. It's killing the autistic person next to me. It's killing you, especially an adult onset autism. They can't get the services funded that they need because it's not thought about.
Yep.
So all of these variables, the system works exactly how it is. You start looking into the history of eugenics in the United States. Germany based their program off the US's eugenics policies. Yep. So if you're ever talking with a disabled person, listen and stop thinking with what you know. Think with your heart, see with your eyes, hear with your ears, and just realize together we're going to do more than what we can apart. And I have solutions that, and Joy, you have solutions, and JB, you have solutions that we've learned the hard way because we needed to be different. We needed to take something that was inadequate and make it enough.
Yeah.
And so we have to do this work. And the statistic for disability, the most recent one that I've seen through the pandemic, is 1 in 3 people.
Yes. Yep.
30%, more than 30% of the US population is impacted by a disabling condition and or disabling medical issues that, you know, that is leaving them behind, making them have to work doubly hard.
Yeah.
So
Absolutely.
we just have to come together.
And, you know, not that I want to end it on like, you know, doom and gloom or whatever you say, but I think, you know, and trigger warning to those watching, I just did a panel on mental health before this, and I want to talk about, you know, the struggle that we go through emotionally, be it coping with becoming disabled, be it being treated differently, be it not being able to afford what we need, anything like that. I want people to really understand psychologically what, you know, what impacts us. We can do the other way now, JB.
Oh Lord, you going on ahead with me? Lord. Okay. All right. I was hoping you were gonna do ladies first again, but oh Lord. What did I tell you about patriarchy? Okay, no, I'm just kidding. You know I love messing with you, Joy. No, gosh. All right, I'm gonna tell a little personal story. When I first got on dialysis and they took me up to the hospital, I was sitting in the hospital room and I was in tears. And I was saying, why me? I think it was later that week or later that evening, a bunch of friends called me on a group call. And they were all just telling me how much they love me. I was in the hospital for 12 days when I first got on dialysis back in 2007. And it was constantly a reminder because I used to be very religious and I used to go to church all the time. And one of the things that everybody would ask me, they would be like, hey, how are you feeling? And that used to piss me off. How are you feeling? And I'm like, I just had my blood circulated over 20 times in 4 hours. How in the hell do you think I feel? I wanted to say that. I wanted to be mean. I wanted to lash out. Like, how the hell do you think I feel? You see me barely being able to function coming here. But I couldn't do that because that's just not in me to do. And so I would say I'm fine. But then to my closer friends, I would vent about it. And you get to a point where you feel less than because society also kind of treats you that way. And you feel like you don't really matter that much. Because now, because of the energy, barrier as well as the time barrier, people don't see you as often. So it's kind of more of an out of sight, out of mind type thing. So they don't see JB as much anymore. So therefore, they don't think of him as much anymore. Or if they're having a little gathering or a party or something like that, they don't invite JB over because they forget about you. And so that affects you even more. And so it's tough because you want people to know about your limitations, but you don't want those limitations to cut you off from society. And that's what I've still been dealing with down to this day. I just learned how to maneuver through it a little bit better and to accept those limitations and make sure those are, vocalized as much as possible. But it's still tough,
Absolutely. We all have our days, that's for damn sure.
Yeah.
Michele.
Yeah. I think there's a process when you become disabled that you kind of deal with your internalized shame, and you have to go through a grieving process. Like, what did I do wrong? How did I do this wrong? If I only did this, then you go into bargaining, and then you go into, whatever else.
Yeah.
Unfortunately, especially with more progressive disabilities, it's an onion. You peel one layer off just to reach another layer. That layer comes off, another layer is miraculously there, and suddenly your onion blew up to 7 onions, as you juggle more, or just as you navigate a world that's not made for us. And then you reach the point that you realize, for myself, I reached the point that I realized my internalized ableism was what was killing me more than what society was at that point. It shifted my point of reference. It shifted the realities. I learned so much from other disabled people that is beautiful in what they do and how they do it, and it's like, how dare you say this person isn't enough? How dare capitalism and racism and ableism and sexism say and determine the inherent value that should be there from birth, no matter what somebody does. Human rights are human rights for a reason. Capitalism says it's okay to circumvent that and to modify it and to make it less than because you don't produce enough for this owner right now.
Yeah.
But yet, like Joy, what you produce through your podcast is amazing, beautiful, and powerful. JB, very much the same. What I do in the community and what I've been able to do I feel very grateful for what I've been able to accomplish. But there's a lot of work behind it too, just because grief, loss, hardship upon hardship upon hardship. And then you get to the self-reflective type point that's like, oh, it's not too much to ask that they have captions on in an event. It's not too much to ask that I get this material ahead of time. Of course, you then still have to frame it hey, yo, people, this is an ADA request, which means you can't say no to me. And that's the weird thing, is they don't want to. How I frame things now is almost like a casual, yeah, I need captions on, make sure they're enabled, and then I have to follow back again and go, oh yeah, and that was an ADA request, because initially they wanted to decline me that service. We live in a space where we go into a leadership space and they don't have accommodations available because leaders aren't disabled people. I don't see myself reflected in certain leaderships. I don't see myself reflected in a lot of things. So there's a whole lot to this. It's a good question though, Joy. We could do a whole podcast, I think, on just this question.
I'm telling you.
we could, I'm thinking about doing one on being disabled and dating too.
Yeah.
We can do that too.
We seriously keep talking about this. I feel like these panels are an hour and a half, and it's like, it sounds like 90 minutes, but it's like 90 minutes. So I want both of you to give any last brief thoughts of what you want the audience to take away, and also Twitter's, emails, websites, or anything, how people could reach you if they want to reach you for props or advice or any of those fun things.
Ooh, ladies first. Ladies first.
You're not going to be a lady today, JB.
Only on Thursday afternoons during tea time.
Yeah, exactly. Me, the best way to reach me is via Twitter, which it's on my name on here, which is at Shell Pfeffer. It's a weird name. There's a long story behind it, but I don't need to go there. I do have a GoFundMe link that's pinned at the top of my profile, and there's some good details about what it is and the reasons why I'm doing it. I think I'm going to be involved in the third party panels next weekend with CJ on the revolutionary. I think that's revolutionary. RBN is doing that. Yeah. I think I'll be on one of those as well. I'm an infrequent guest because my life is overwhelming and I can't figure out how to do a regular podcast because my brain thinks too much. And it is a lot of work. It's not as easy as what some people seem to think. It's not just throwing a video together and doing it. It takes a lot of work behind the scenes. And the other thing, huge shout out to the group that put this together, every piece of it. It's been impressive. I've received some amazing feedback as well from my community members on the different sections being, very informative and important. So, but huge thanks to you guys for what you're doing.
Thank you, JB. Oh, and before I go to JB, who is this gorgeous creature?
This is my Miss Kitty.
Cutie pie.
Kitty. She's my 15-year-old cat. So
she's beautiful.
She acts like a dog. So yeah.
JB, nice. You said ladies first. So
definitely.
What do you want people to take away from this, and where can people find you in case they didn't know?
Okay. Look, one of the things I want you guys to take away from this is that we are human beings. We have the exact same inherent value that you do, and therefore we want to be seen just as much as you do. So please give us that respect as well. Not just in emotionally and mentally, but also when it comes to our material needs as well. You guys can find me at JB Font on Twitter. You guys can also find me by the same name, JB Font, on my channel on YouTube and also on Revolutionary Blackout Network on YouTube as well. What was I going to say? Oh, and by the way, here's another thing I want people to recognize. Those of you who are in states where marijuana is still either partially illegal or completely illegal, the people who probably might need medical marijuana, it costs a lot of money just to be able to get that through. So if people recognize that, those of us who are disabled, we can't get it like we need it. Yeah, I think that's something to also look into. If you guys, know somebody who's trying to get it, but they just can't afford it, try to, throw them over a couple bones to make sure they can get it so they can be able to help themselves to be able to cope with life or deal with the ailments that they may have. So just to put that down there. Also, just to let you guys know, I also have my Cash App link to my pin to my page. So just to let you guys know that. But yeah, if thank you so much to everybody for having us on. Thank you to the March for Medicare for All crew. Thank you to you, Joy. You've always been such a brilliant and masterful orator, and allowing us to be able to share the space with you so that we are able to vocalize our needs and so that people can recognize our humanity. And so I think one thing you'll always be remembered for was she was loud and she let people know. And I think I appreciate about you so much.
Oh my gosh, much love to both of you. I cannot thank you enough. You are both inspiring, incredible, and I just adore you both. So thank you so much.
Thank you so much.
Thank you, everybody.